Hello and welcome to this episode of Community Connections, airing right here on OROMIA11. I am your host, Anna Orr, and today we are talking about a very special initiative that launched in the month of January at Sabathani Community Center. We are talking to two women responsible for Maternal Health Matters. This is going to be an episode you won't want to miss. I'm so excited to have Naomi Abraham and Rebecca Floyd here on the program. Welcome.
Thank you so much.
Now we are talking about Maternal Health Matters, the program that you all have launched in January at Sabathani Community Center.
Yeah.
Talk to me about the work of Maternal Health Matters.
Yes. So starting out with the statistics, which they're alarming. The Minnesota Department of Health, it reported that Black birthing individuals generate 13% of Minnesota's population. Now that doesn't seem like a lot, but out of the 13%, 23% actually experience pregnancy-related deaths. And that, again, as I said before, it's a really alarming statistics. And going more in depth, Black birthing individuals actually are 2 to 3 times more likely to experience pregnancy-related deaths compared to their white counterparts. On top of that, we noted that most of these deaths occur in the 4th trimester, also known as postpartum, and that happens typically from 6 weeks postpartum to 1 year postpartum. And, you know, this is a problem. Minnesota it's known for its top-tier healthcare, and we know that we can do better to serve Black individuals. So Rebecca here actually helped generate the grant that we are now serving and has now turned into Maternal Health Matters. So, yeah.
You all are here as community health navigators. Can you talk about what that work is like, Rebecca, and what the nature of that work really is for people that may be unfamiliar?
Yes, so we are building the program, the maternal health program at Sabathani, and just bringing in partnerships and programs to help with the maternal health, just to help with the stress relief. So that's what our main focus is building programs that can help women, like the yoga, and we're going to have get-togethers we call Mommies and Mocktails, which is Naomi's, that's her creation. We're going to have a lady from the University of Minnesota Extension program that's going to come in, and she's going to make healthy smoothies and teach the moms how to make them themselves and teach them about the benefits of the ingredients, how it'll help with that. And then we're also going to have other programming as well.
Yeah, we will be providing one-on-one visitations. We wanted them to be called home visits, but we do understand that some people might feel uncomfortable with, you know, us coming into their homes, into their safe space. So we want to meet our clients and the patients where they're at, right? So if that means we're going to go to a coffee shop, or we're going to go get some tea, or we can meet over Zoom, or we want to do what's best for our clients, for the patients. And with our home visitations, we'll be checking in, you know, how are they doing? How are you feeling? What resources can we provide for you? Let's help you with education. We're trying to help improve health literacy. We understand that some of these clients that we've personally spoken to they had no idea what was happening in, you know, their doctor's visits. They were just, you know, nodding their head and agreeing, and they have absolutely no idea certain terminology, certain plans. So we want to kind of help them just navigate that process so they feel empowered when they go to their next visit to just have more of a voice and, you know, ask the right questions. So, you know, Rebecca went into a little more detail with some of the programs, Mommies and Mocktails. we also are having an Adopt a Grandma program. We forgot that's a really exciting one. We will be partnering these clients with an elderly mother or a grandmother who's had experience with childbirth and parenting. And, they also check up on these individuals once a week. And, we want to nurture that wisdom. Intergenerational wisdom is very powerful and very important. And, these clients feel that they have some support. That's the biggest thing. And that's how, pregnancy-related deaths, they do stem from stress. So having support reduces stress, and we hope in long term that reduces the pregnancy-related deaths.
I like the idea, like you said, of adopt a grandma.
Yeah.
I think in this day and age, we look around and grandmas are getting younger and younger, and we're not having the cultural norm of gathering at grandma and grandpa's house, or even being able to pass down family homes. And so a lot of kids are growing up without having that foundational experience. And we know statistically that creates a longer lifespan for elders and improves the quality of life for the youth, and the support, relieving of the stress, like you talked about earlier, with the moms that they are able to nurture throughout this experience. I think that's going to be a beautiful program, especially for a generation that is being left behind as we become individual, I think, but also as we become more progressive from digital tech, things like that. They're starting to feel a little left out.
Yeah.
We noticed a lot of that during COVID. People were experiencing such depression and suicidal ideations because they were feeling isolated and disconnected from their communities. Whether you were able to go to a senior center, you were able to go to church, the food shelf, those programs were starting to see less and less people. I think this is going to be really important for the support of parents, but also the support of the community at large.
Yes.
Talk to me a little bit more about the focus of the timeline. You said that care is going to go from the beginning of inception to 1 year postpartum.
Yes, because per the statistics, the highest pregnancy-related deaths happen from 6 weeks postpartum to 1 year postpartum. And most people, actually, even myself, I didn't know that postpartum really lasts that long. And we just want to give the tools and the resources to feel empowered and confident and beautiful during pregnancy, to know that we have you. We're creating that support system for you. So, even beyond, 1 year postpartum, individuals are still welcome to come at Sabathani and still be a part and still mentor people that are in that phase from, upon conception to 1 year postpartum. We don't want our clients to just graduate and leave the community, still be a part of it. There's always a place, and we're willing to grow and expand our program. And we've nurtured these individuals and these clients, and we want to maintain that relationship.
Now, Rebecca, you all just launched in January. What has been the feedback from the community or participants in the program currently?
So we are currently recruiting participants, but the feedback has been great. Like, people are really excited about this program, and there's communities, partners that have already been doing this work, and they're just, when they hear about all that we're going to be doing, they're really excited for us. They want to jump in and help, and so I'm thinking it's going to be very successful and needed. It's much needed. So I'm thinking it's going to be a wonderful program. We certainly are excited about the possibilities and just building it and making it accessible to everybody in the community that needs it, and just helping to lower those statistics down and get people healthy and happy, and and have fun while they're doing it.
For those interested in participation in the program, what does that process look like?
Yeah, so we actually have an interest form online at Sabathani's website, www.sabathani.org. You can go to our programs. There's down the list, there's a health and wellness opportunity, and you'll see Maternal Health Matters. And there, again, it's an interest form. There's a list of questions. It provides us information of the needs and resources you currently have and what you're looking for. And then from that, we'll be able to schedule a one-on-one consultation so we can have more in depth with the individual and we'll get them started. Simple as that. We also have flyers, but that's at Sabathani. I'd say the interest form is the best way to go online.
Okay.
Yeah.
I want to make sure people have that information so that they can connect with you guys, because I think this is going to be wonderful, but also it's too essential to pass up.
Yeah.
You all spoke a little bit about the programs you guys are currently offering, and I've heard a little bit about maternal health. I have a sibling who's a doula and who is doing this work out in the community, but some of the programs you all have chosen I have never heard of. How did you all decide which programs to offer or what events to offer the community when you all decided on what Maternal Health Matters looked like?
Yeah, well, with Mommies and Mocktails, as Rebecca stated, it was my creation. Little background of myself, I'm a 29-year-old individual. I love a good cocktail. However, when you're pregnant and breastfeeding and or chest feeding, that is prohibited, right? So I was thinking of a fun way to, get that satisfaction, and mocktails. Okay, you can still have that juice aspect, but with that, we thought more creatively. It would be more interesting to use this as an educational opportunity for individuals in the community. We could break down the ingredients, explain what each ingredient does and how that benefits, both the birthing person and the fetus, and even the child. If they have children already, they're welcome to drink it. It's free of alcohol. With that, we want to also increase participation and attendance. So Rebecca and I collaboratively thought that, hey, we are also willing to provide participants with a NutriBullet at the end, attend 5 classes consecutively, and this is yours. You can take this at home and you could make it yourself. We've taught you this particular, concoction, that particular concoction, and you can make it at home and enjoy. But I think the biggest aspect of Mommies and Mocktails, apart from the educational aspect, is the social component. And that social component is, everyone is together, they're learning together, and they sit and they drink together and they just have conversations. They ask, how's their week been? They can just support each other with, different areas of their lives. And that program actually has not only been just of an interest to individuals, the birthing individuals, our grandmas from the Adopt a Grandma program, everyone wants to join it. So I think that will be a very popular program that we're going to have at Sabathani.
It sounds like you guys are really not only engaging the community, but also fostering community for a lot of people. And we know that oftentimes moms speak about how their social interactions suffer once they become moms, whether it's through pregnancy or afterwards. They're like, where have my friends gone? The phone starts to ring a little bit less. And who doesn't want a NutriBullet? I mean, you get the opportunity to make some really cool mocktails, but also it can help you make some really good natural baby food as well.
We want them to nourish their bodies in a healthy way, and everyone deserves that. Everyone deserves a healthy opportunity.
I think that's really important. Now, we talked a little bit about community partnerships for the upcoming baby shower you spoke of that's taking place in March. Rebecca, can you share with me what that event is going to entail?
Yes. So we're partnering up with Way to Grow, and we're going to have lots of activities like painting or decorating picture frames and onesies. We're going to have health education. Way to Grow is going to be providing that at this time. And we are also going to have a raffle. And we're going to raffle off a photo shoot.
Okay.
Or 2 photo shoots, I believe. So professional, so they can have a picture of the baby or a picture of the mommy and with the baby, or a family picture, whatever they choose. And then we're going to have, also we're going to have other giveaways. We have some gift bags for the moms. We're going to have like a nice sash for them and a little crown for them so they can feel special. And am I missing anything?
No, that's...
Oh, food.
Oh, yes.
It's gonna be a catered event, so we're gonna have some delicious food as well.
Where's the baby shower going to take place?
The baby shower is at Sabathani Community Center and the Banquet Center.
Okay, and the address of Sabathani for people that are not familiar with the south side of Minneapolis.
Yes, it's 310 East 38th Street, and that's in Minneapolis. It's in between 3rd Avenue and 4th Avenue, and right next to the fire station.
That's a good landmark for people that may not be familiar. If you're near the fire station, you are close.
Yes.
Now, you talked about partnering with Way to Grow for the baby shower.
Yes.
Are you all open to any other community partnerships potentially?
Absolutely.
Yeah.
And if so, what would you hope that they would be bringing to the table to kind of help foster the vision of what you guys have so far?
Right. No, and we currently are in talks of building more partnerships. We're in talks with individuals to see where, we want our programs and our organizations to be mutualistic towards one another. We are providing the emotional and social component for maternal health. And we're looking for other organizations that want to further that, want to expand that. We also are willing to partner with individuals that have a clinical component. None of us are medical professionals, and we would like that aspect, to refer our clients to if they don't have access, to the right health care and they want more options. So we essentially are looking for anyone with similar values, similar missions, similar goals to serve the individuals in marginalized communities.
Is there any current connection that you all have with the faith-based population?
Not yet, but that is something that we are looking into. Religion does play a big factor in health outcomes, so we're looking into anything, really.
Okay.
Yeah.
Hopefully someone that is watching this is sure to reach out to you all. I know there are so many churches in that area that can benefit from this support, and a lot of families that I feel like are watching this hopefully going, I think I'm interested, or at least would like to see what's going on. There are so many good resources, and you all sound like you really are connected to this work.
Yeah.
Share with me what your personal connection is for this vision to prosper.
Yeah. Well, I'm a self-identified Black woman. I'm first-generation Eritrean American, and I hope in my future that I have children, and I would like to experience a healthy and safe pregnancy. It should be a joyous moment for any individual, really. And again, the statistics are alarming to me. I'm very fortunate and blessed to have the education that I do, but that's not enough. So serving in this community, I'm learning more, not only about the individuals, but more about the healthcare system and how to also advocate for myself. We all think that we know how to empower ourselves until we're in that moment. So teaching these individuals to be in this program inspires me to also not only help empower the individuals, but myself. So, that's my personal component to it.
Rebecca, I know that you wrote the grant. What was the thing that drew you in to say, I think this is something that Sabathani can connect to?
So I didn't know the statistics until I heard about the grant, and then finding that out just really made me want to get in there and help as much as I can. And I'm a community health worker, so it's just something that I'm just driven to get in there when there's a need and do what I can to help. I'm a mom, I'm a grandma. Fortunately for me, I had very healthy pregnancies. But learning about just, how many people of color there are, specifically Black women and Native American women that are not so fortunate, anything I can do to help with that is I have to do it.
I think that's important, specifically in this political climate when we're watching so many rights being challenged and taken away. It seems like day after day. I think it's essential for people like you to step up and to say this is important and this is something that we can't let fall to the wayside for our communities.
And to add to that, you know, vital information has just been vanishing, so it's very important that we are creating awareness into the community, into the public. We are planning on doing research within our program, you know, to determine that the program is effective, that it is working, and that we are, you know, reducing stress in Black birthing individuals, and that we are improving maternal and infant health outcomes. And this is the time for us and every healthcare individual just to raise their voices, community programs like ours, to really just shout to the top of their lungs of what's happening.
Rebecca, I'm going to ask you first. Where do you hope to see the work of Maternal Health Matters expand to over time?
I hope that it expands everywhere, that we can make connections throughout the country with other organizations that are doing the same work, and we can just have everybody become aware and know that they have a place to go. You know, they're not alone.
Naomi, I'm going to ask you the same question. Where do you hope to see this initiative expand?
Yeah, adding on to Rebecca, I would like to see it expand, not just within the Twin Cities metro area, but the entire state of Minnesota. I really want us to expand throughout the country, and even greater, I want us to expand to areas around the world that Black birthing individuals are experiencing these similar statistics. We can apply it everywhere. We just want to show that it works.
Now, we spoke about the baby shower coming up, but is there anything else taking place that the community should know about? We want to make sure that we keep them in the know.
Well, so far, you know, we have the community baby shower. We are in the plan of creating a brunch for Black Maternal Health Week on April 12th. It will be from 11 to 1. We are still building that, but the community can look out for that. We have a bunch of new programs happening in the summer, but you know, things are still working. We're still in the talks. But I'd say these two special events are what's really big, and it's for the community, and we hope that individuals come and show out. Yeah.
I'm sure they will. Thank you both for joining me today, Rebecca Floyd and Naomi Abraham. I appreciate all the work you guys are doing at Sabathani with this initiative, and I hope that someone watching this reaches out to you all to start to reduce the numbers around mortality and deaths around suicide from birth parents that are struggling.
Yeah, and we look forward to serving all these individuals. They're all welcome, and Sabathani, their safe space. Thank you.
Thank you.
Unfortunately, that is all the time that we have for today's episode of Community Connections. As always, I am your host, Anna Orr. I look forward to connecting again with you soon.
imaluudhaaf karoora qabdanii imaluudhaaf karoora qabaattaniif dhibee gifiraa yaadachuu hin dagatinaa. Imala keessan irraa yeroo deebitan yaadannoo gaarii malee dhibee gifiraa fudhattanii hin deebi'inaa. Imalaan duratti isinii fi maatii keessaniif talaalli MMR dabalatee talaalliiwwan barbaachisan kan akka ta'an baruuf ogeessa fayyaa keessan dubbisaa. Imalarraa deebitanii torban 3 keessatti mallattoolee akka laydaa yookiin dhaqna gubaa fi madaa diimatee qaamatti isin bahu yoo ofirratti argitaniif doktora keessanitti bilbiluun mallattoolee fi iddoo itti maltanii turtan ibsaa fi dhibeen gifiraa akka hin fafacaaneef wal gargaarree haa ittisnu. Waa'ee dhibee kanaa gadi fageenyaan baruuf immoo www.health.state.mn.us/disease/measles/basics.html haa daawwannu.